Hi there, Nurse Master Charlie here. November is Diabetes Awareness Month. Every Wednesday for the month of November, I'm going to be sharing about the different types of diabetes. Today I'm going to be sharing about type 1 diabetes. If you missed last week's topic on prediabetes, please be sure to catch it on YouTube, Instagram, and or even TikTok. So what is type 1 diabetes? Type 1 diabetes is a type of diabetes in which the pancreas no longer has the ability to produce or make insulin. Statistically, of all the people with diabetes diagnosed in the world, 10% of those would be people with type 1 diabetes. That doesn't sound like a lot of people, but consider in 10 people with diabetes, 1 of the 10 would have type 1 diabetes. Now, the onset of type 1 diabetes is abrupt, fast, and quick as compared to the slow, gradual onset of type 2 diabetes, which I will be discussing in the next video, so stay tuned for that. And in type 1 diabetes, it does not occur due to poor dietary habits or lack of exercise and or a not so healthy lifestyle. Now, type 1 diabetes is actually an autoimmune disorder. This is where the body's immune system, which is responsible for attacking germs, bacteria, viruses, etc., that infect the body and also to protect the body, it decides to attack the pancreas. It is not known why this immune response occurs, but it is this immune response that is responsible for attacking the pancreas, specifically the beta cells within the pancreas, which are responsible for insulin production. Now, type 1 diabetes used to be labeled juvenile diabetes or juvenile onset diabetes, and it is more commonly discovered and diagnosed in children, teens, and young adults. However, as it is an autoimmune disorder, it can technically happen at any age. So what happens in type 1 diabetes? As I mentioned, it is not known why type 1 diabetes occurs. It is theorized that there may be a genetic predisposition as a type 1 gene carrier, which may then be triggered by an illness or perhaps an environmental stimulant. So what are the signs and symptoms of type 1 diabetes? The signs and symptoms of type 1 diabetes can include unintended weight loss, weakness and fatigue, blurry vision, extreme thirst and hunger, frequent urination, new onset of nocturnal enuresis or bedwetting at night, and possibly increased irritability. One sign and symptom that usually leads to the discovery of type 1 diabetes is DKA or Diabetic KetoAcidosis, which usually occurs slowly with early symptoms of extreme thirst and excessive urination. Now, as it is not common to consider DKA as a reason for a child's or young adult sickness, symptoms are often unrecognized until more severe symptoms rapidly begin. These are fatigue, muscle stiffness, nausea and vomiting, rapid deep breathing, headache, stomach pain or cramping, dry skin and mucous membranes, and a fruity breath smell. So what is the treatment for type 1 diabetes? The treatment for type 1 diabetes was discovered in 1921 and was first used in people in 1922. What am I talking about? I'm talking about insulin. The first insulin used were those taken from pigs and cows, but now synthetic insulins are used. Prior to the discovery of insulin, there was no treatment for type 1 diabetes, and people with type 1 diabetes would not live very long after being diagnosed with it. Nowadays, people with type 1 diabetes live long and productive lives managing their type 1 diabetes. People with type 1 diabetes have to monitor their blood glucose frequently, eat a balanced diet, exercise, and take their insulin daily. Now remember, people with type 1 diabetes did not get type 1 diabetes because of their diet or drinking too much soda or eating bad. It is an autoimmune disorder. So until next Wednesday, stay safe and not too sweet.